pregnant myself in my early 20s. Before that, I didn't really think about it. Some people were circumcised, some weren't. And when I noticed the difference, I didn't really have an opinion about it. It's just something people weren't talking about. Then I was pregnant and having a boy, and at one of my OB appointments, they gave me a deposit slip with like itemized things on it for the delivery. And circumcision was written on it with a box next to it, and it was pre-checked. And that made me feel really angry. It just...
Somebody decided for you, yes.
Yeah, I felt violated that my OB did not ask me. She was not trying to educate me about this. And I instantly knew this is not something I wanted to do. So then I thought about what my husband would say, and we literally never talked about it. So I showed him the deposit paperwork, and he said, "Oh, circumcision? I never thought about that." And I asked him to look into it, and I was really hesitant and afraid and so nervous. I built up a whole arsenal of resources, like tons of tabs on my laptop, because I was ready to fight over this. But to my great relief, he came back saying, "We are not going to do this. Have you seen what circumcision actually is?" And then pretty quickly, we both shared strong feelings about how disappointing it is that our generation did not get properly educated. But it was nice to find out that there are so many others in the same boat.
When I was a labor and delivery nurse in the hospital and we had a slow night, they sent me to the nursery to help out, and I saw the first circumcision, and it was horrifying, absolutely horrifying.
I'm so sorry.
Yeah. Well, why do some parents do choose to have their babies circumcised?
So there are actually kind of a lot of reasons. Many of those following the Jewish and Islam faiths choose circumcision for religious reasons. Though interestingly, I've learned an increasing number of them are deciding to leave that particular tradition in the past as something that's outdated or irrelevant for these times. And we have resources written specifically by and for those of the Jewish and Muslim faiths, which I like to share because I'm not personally religious, and I don't feel like it's my place to tell somebody how they should practice their religion. But I do think it's important to be aware that there are variations being practiced by their peers, and I like to give space for those perspectives. Mm-hmm. Then also some Christian and Catholic families also circumcise for religious reasons, though historically circumcision has actually been forbidden in the Christian faith. St. Paul actually often condemned circumcision of the flesh, and it was considered to have no spiritual benefit to do so. And so we also have resources written by and for Christians on this. And a majority of Americans who choose to circumcise do so for medical reasons. They may subscribe to the idea that it will prevent infections, STIs, cancer, and other things like that. But interestingly, medical circumcision didn't become a thing until Harvey Kellogg, the cornflakes guy, made a public campaign for circumcision of boys and girls to prevent a whole host of things that were later revealed to not be true at all. And the push for circumcision in America began in the Victorian era purity movement. It was believed to prevent masturbation, which at the time was considered to be unhealthy and sinful. Now, of course, we have research to prove that the medical claims supporting infant circumcision don't hold up either. And of course, I do think that parents are trying to do what's right and believe that they're making a healthy choice for their baby. But, when doing any research on this, particularly with regard to medical claims, I always tell people to, make sure that the supposed research, just make sure that whoever is writing it, funding it, things like that don't have conflicts of interest, because we see that a lot. And then, of course, I think most popularly, American boys are circumcised for social reasons, mostly informed by personal experiences. Some of it's about, the quote-unquote locker room concerns, though not as much anymore, since a growing number of boys are not being circumcised anymore. But usually it's because the dad is circumcised, and he thinks if his son is circumcised, they'll look the same. So I think that's most of the common reasons of why people are choosing it today.
That was a big reason many years ago, was dads didn't want their sons to look different. Well, what are some of the reasons that parents choose not to circumcise?
So times have really changed. New generations of parents seem to be questioning everything, or at least are questioning more in general than previous generations might have with the same topics. With the internet and access to information, they get immediate answers to their questions from a variety of sources, and they get involved with conversations that people around the world are having about things. People started seeing that circumcision isn't a given, and many people don't do this, and they still raise healthy boys, so why are we still doing this in America? We can now also see videos of what really happens in the circumcision room. We have documentaries and university lectures and dissertations and whole activist movements for this topic. Men are starting to speak out about what happened to them and how it has affected their lives. We're seeing a higher value being put on human rights, consent, gender equality, and the trend in our culture is moving toward natural, organic, and whole, and away from antiquated traditions. So I think all of this greatly impacts the lens through which we're starting to view routine circumcision.
Yes. How common is circumcision in the United States? Is there differences now? Do the statistics say something a little different?
So in 2010, which is the most recent data that we have, the CDC reported the rate of boys leaving the hospital circumcised decreased from 56.2% in 2006 to 32.5% in 2009. So that means that the last estimate, the national average of boys remaining intact was nearly 68%. On the West Coast, the rate is in the low teens or less, and in the Northeast, it's still pretty high. Texas was about 50% when the stats came out. But overall, boys who are kept intact these days are in good company and will remain so as they get older, especially if they choose to live outside the U.S., because it's estimated that 80% of the world's men do have their foreskin. So, the rate of circumcision is trending downward, and now in 2021, the rates are likely even a lot lower. As far as globally, circumcision is only prevalent in the U.S., Islamic nations, among Jewish groups, and then tribal youth circumcision is prevalent in some areas of Africa.
But it is changing rapidly.
Yes, and I'm sure that a lot of birth workers see that as well, probably with the babies that in the families that they're working with too, if they've been around long enough to see that change.
Yes. Well, let's talk a little more detail. What is the function of the foreskin? What do we need it for?
So that's a really good question because it's something that people don't usually consider. They don't usually consider that it is an organ with a purpose, or really quite a few purposes, actually. So foreskin is a double-layered sheath that makes up about a third to half or more of the total skin of the penis. It's not just a flap of skin. It's got tens of thousands of specialized nerve endings that are sensitive to temperature, motion, and touch. More sensitive than all the tips of the fingers, actually. Several feet of blood vessels for proper blood flow. It also has important things for the male immune system, like antiviral and antibacterial proteins, antibodies, and cells. Perhaps the most important function is that it's protective. So in childhood, foreskin is closely adhered to the glands or the head of the penis to keep bacteria, debris, and contaminants out and keep it safe from abrasion. And it has a sphincter opening to ensure that urine flows out, but nothing else gets in, which is especially important in those early diapering days in early childhood. And the glands is meant to be an internal organ. It's supposed to be soft and wet mucosal tissue, like an eyeball or the inside of the mouth or the vagina. So the foreskin covers it to keep it moist and sensitive. And then when the penis is erect, it rolls back for sexual activities for the maximum pleasure that nature intended. So I always tell people to think about this. What would happen to your eyeball if you remove the eyelid, which is its protective cover, right? So the eye would dry out and become either significantly desensitized or hypersensitive to the point of pain, and your ability to see would be permanently damaged. So unfortunately, similar risks are what we see with the removal of the foreskin. And then as far as sexual pleasure, it's beneficial for the other partner too. Foreskin provides more of a gliding action during intercourse with less friction and rough stimulation needed to achieve a good feeling. Artificial lubrication is commonly needed for circumcised men, and a lot of Americans have kind of gotten used to, well, that's just the way it is. But really, for intact men, this is not common. They have sebaceous glands to make their own natural lubrication, which makes sex more comfortable. Foreskin also has apocrine glands that produce pheromones and estrogen receptors. This has only been recently discovered and is pretty interesting because it's thought to play a pretty big role in male to female bonding. So there's quite a few functions, and you can look those up online. It goes on and on. So
those are really good reasons, and I wish everyone could hear this.
Mm-hmm.
It makes such a difference. So what are the risks of having a circumcision?
So on a typical consent form for circumcision, usually only a few of the short-term risks are mentioned. In truth, there are actually many risks that aren't frequently discussed. So first, all the functions of foreskin are lost, including all the ones we just mentioned, as well as the organ itself, obviously. And when you change form, you change function, which means that the penis will never work the way it was biologically meant to. Sometimes the glans is partially or entirely lost, though this doesn't happen often, but it does happen. And in fact, one of the popular circumcision devices called the Mogan clamp was recently sued out of business for causing too many accidental glans amputations. The frenulum, which is considered the most erogenous zone of the penis, is almost always destroyed or ablated during a circumcision process. As a lot of lactation consultants might be able to describe to you, we know that the bonding between mother and infant is interrupted, which often leads to breastfeeding troubles. And there's been documented evidence on this, but I think it also just kind of makes sense that in early infancy, physical and psychological trauma could affect feeding and bonding. Blood loss is another risk. This one is one of the common ones. A baby only needs to lose 1 ounce of blood to hemorrhage and just 2.3 ounces to die as a result of this blood loss. Out of 100 circumcised boys, 35 will have some degree of post-op hemorrhage. I've personally spoken with many parents who admit their baby almost died after circumcision. A few told me their baby needed to be light flighted to a different hospital for critical care. It's really difficult to hear these stories. Out of 100 circumcised boys, 10 will need a repeat circumcision to fix surgical mistakes. And pediatric urologists have said most of their business comes from circumcision revisions. So it's obviously something that is pretty common. Serious complications occur as well: seizure, stroke, heart attack, loss of penis, and even death do occur. And a lot of people don't realize that. Other risks include meatal stenosis. This is one of the most common, if not the most common, long-term complication. It could show up years or decades after the circumcision. It almost never occurs in intact men or boys. It's commonly seen in circumcised men. It's a dangerous narrowing of the urinary tract. This is from callousing due to a lack of protection over time. Buried penis, hair on the shaft from excess skin removed, skin bridges and tags. There's really so much more. Sexual effects including erectile dysfunction, which is an astounding epidemic in the U.S., but not commonly seen where men remain intact, such as in Europe and South America and such. So yeah, I mean, the list just really goes on and on.
That's really good information. I'm so grateful that we can get this out to our audience. Some people have thought that circumcision prevents sexually transmitted diseases, or that circumcision can actually cause infections. We hear that. What would you say about that?
I would say that no, there really isn't any medical research out there that accurately supports this misconception. This myth that circumcision somehow prevents STDs and infections has little basis in reality. We've probably all heard that circumcision is encouraged in Africa as a way to prevent AIDS and HIV. About 10 years ago, there were a couple of really flawed studies that seemed to support this, but many studies since then have refuted that claim. Unfortunately, because that erroneous belief has become so widespread, condom use in Africa has actually dropped because men think that circumcision alone will prevent them from contracting HIV, when really condoms are still completely necessary. So either you can, have the surgery and wear a condom, or you could just wear a condom and it's really the same level of protection. And then as far as other STDs, cervical cancer, penile cancer, UTIs, and those sorts of things, every one of those claims fails to produce reliable scientific research to back it up. And as far as infections, a circumcised boy is actually 12 times more likely to get a staph infection, which is just one of the many types of infections a baby's at risk of contracting during a surgical procedure. And, during the healing process, remember that the circumcision site is an open, raw wound. This is covered in an abrasive diaper that's filled with urine and feces, which itself is an infection risk. And I think a lot of people don't really think about that and aren't really prepared for that reality sometimes.
Yes. Well, if I'm a new parent and I'm considering that I might not circumcise my son, how am I going to keep an intact penis clean?
So this is a really simple and easy answer. Only clean what's seen. So for a baby, you just wipe or dab the outside like you would a finger. Many parents even say that keeping their intact boys clean is easier than their baby girls, with all the folds and everything. But just like you wouldn't clean inside a baby girl that just, seems invasive and unhygienic and can cause infection, you don't push the boy's foreskin back to clean underneath. A lot of misinformed American care providers tell parents to do this, but it's actually terrible advice because it can lead to chronic infections, which is directly caused by trying to, it just makes the foreskin way more complicated to care for than it is, really. And when the boy is older, if he becomes retractable, he can retract in the shower and briefly rinse. A parent should never retract their son, though. Even if he's very young and retractable naturally, it's not necessary to clean or rinse underneath. In fact, that can be harmful, so it's best to just really leave it alone. When he's old enough, he can retract it himself if that feels like the right thing for him to do. As far as the age of retraction, there was a study done on about 300 boys to determine the average age of retraction. It concluded that most will become retractable by age 3, but this was an old study, and it kind of led medical professionals to believe that it must retract by a deadline, which isn't true. A follow-up study of thousands of boys found only 50% are retractable by age 10. So most boys are naturally retractable by puberty, but it's not unusual to remain unable to retract until well into the teens, the late teens even, because it's a sexual function and not a hygiene function. So if your son is not retractable, by toddlerhood or whatever, that's totally fine.
I hear lots of horror stories about pediatricians and other care providers who retract at an office visit. I hate to put you on the spot, but would you have any advice about that?
Yeah, so My advice for that situation, because I hear about it a lot, first of all, to prevent that from the beginning, definitely interview your pediatrician in advance, just so that you're on the same page about what to expect. I also like to encourage a diaper on policy. There's really no reason that the care provider needs to be poking around or looking at anything down there unless there's specifically a problem. And if your provider is making a fuss about that, that's a red flag. A good provider will be okay with that. As far as like babysitters, daycare, and things like that, you can also just write like on the diapers with a Sharpie, do not retract penis, wipe the outside only, something like that. It's kind of a non-confrontational way to get that information to them.
Because the truth is they just don't know. They don't have the information that you presented in this evening, that they just need a little more education or they would not be doing that.
Right, yeah.
What about parents that can't agree on the decision? Have any advice? The dad wants the baby to look like his son, to look like him, and the dad didn't do what your husband did. He didn't go and get information.
Right. So this happens a lot. I always say there's no rush. So why the rush to schedule this cosmetic surgery? Sometimes the gravity of the thing doesn't really hit people until their baby is born. And, they've held him, they've gotten to know him, and their protective instincts kick in and they realize, he's perfect just the way he is. So there's really no need to rush. There's also no need to even make a decision at all. So a lot of people, they fret and they worry, like, what are we going to decide? You could just not make a decision. Leave the decision up to your son. He's the one who will be personally affected. So why not let him decide for himself whether or not he wants to modify his own body one day when he's a consenting adult? Yes. Is it really a parent's business to make the kind of decision that impacts their parents' future health-wise and sexually and in a permanent way?
Yes, I love that. I had so many couples who made a decision where one parent, usually the mother, was so against it. But she did it anyway because that's what her husband wanted, and so she did it. And then I watched her agonize for months and months, and maybe years, over every time she changed the baby's diaper and saw what had happened. And her heart was hurting. And it brought distance between them as a couple over and over. I saw that happen. And so I recommended to my couples, if you're not in agreement on your decision, don't do it, because one of you will be unhappy.
Right. Yeah. And, for the parent who doesn't want to do it, you really have to step up and be your child's advocate. This is your time to lay down that boundary, and whatever support that you need to be able to do that, reach out for it and make it a priority, because as you were saying, the regret parent stories are numerous and heartbreaking.
Yes. So we're just about out of time, but what are some of the top concerns that people ask you for advice?
So we talked a little bit about the retraction at appointments, and that's kind of a main one that really I would say. As far as the top concerns for advice on circumcised sons, usually people reach out about circumcision complications that their children are having. Women reach out about issues their partners are having, some of which can be minimized with foreskin restoration, when I really encourage people to look into that. Sadly, the most common thing people bring to me about their circumcised sons is the regret stories. They've gone into it with good intentions, sometimes thinking it would be no big deal, trusting their doctors, all of that.
Yes.
But, when you know better, you do better.
Yes. So tell us, how has your message been received? How can we...
This mass, multiracial, not to mention multi-gendered and many-aged movement is led by people who occupy